Welcome to End of Life University on YouTube. In this tutorial, I'm sharing some tips and ideas on how to make a difficult end of life decision for a loved one. And I'm speaking specifically about a situation in which you have no idea what your loved one might prefer. You've never had a conversation and don't know what their own wishes might be, yet you're being called upon to make a decision. And this scenario unfolds every single day in ICU waiting rooms and emergency rooms all around the country. People are asked to make critical decisions in the moment of a crisis for a loved one, and they don't have the slightest idea what their loved one might prefer. So they need guidance and help for making these kind of decisions. That's why I created this tutorial, and I have a handout available as well that you can store on your phone or your computer, just in case you ever find yourself in this very challenging situation. And of course, to avoid this happening to you, I always recommend that you have these conversations long in advance with all the people closest to you and anyone for whom you may end up being responsible someday for making decisions. So I have a few slides to share with you, and here I'll get them started. Just a second. All right, how to make difficult end-of-life decisions for a loved one when you have no idea what they might want. The first step is going to be to gather medical information, and you need to get as much good information as you possibly can from your loved one's healthcare team. I realize you might be in a crisis situation where you're being asked to make a decision right now, but it's still important that you take a few moments to ask some questions. If you have time, write down the answers so you have this information in front of you that you can look at. The first question to ask is, what is the diagnosis and what complications have occurred? You need to know as much as you can about the current situation for your loved one. What is going on? And make sure the medical team explains it to you, if they have to, over and over again, in a way that you can understand without using a lot of jargon. And keep asking the questions until you feel you have a grasp of what is going on and what led up to the situation that your loved one is in. Next, ask about the treatment that they're recommending. How effective is the treatment for a patient of this age with this medical condition? And really pin down the healthcare providers here. What they may say is, well, your loved one will die without it. But if they go through with the treatment, what is the likelihood that your loved one will survive? And under the best of circumstances, how effective might this treatment be? So, say some kind of surgery is needed for an elderly loved one. Ask them, is that surgery good at resolving the problem that they have? Or say they want to put in a feeding tube in a loved one. Will that change my loved one's condition if you do that treatment? And then following that question, what are the chances for recovery or improvement with this treatment? So it's helpful to know, is this treatment actually going to make something better? Or is this treatment going to prolong the dying process? Is this something from which my loved one is still going to die in a week or so without recovering or without improving? Will this surgery or this feeding tube only delay what is inevitable? Again, healthcare providers may not want to ask all these questions, but it's really important that you ask them and pin them down. They may not want to answer them, but do your best to pin them down and get their responses. Next, what side effects or additional suffering could be caused by the treatment? You really need to know that. How much pain will be inflicted? What will your loved one go through if they do this treatment? What might happen? An example of this is my mother. When she was in the hospital near the end of her life, they diagnosed biliary cancer, One of the possible treatments was surgery to remove the blockage that was present, but they admitted that there was a high likelihood with her other medical conditions that she would die on the operating table or she would die from complications of the surgery. If she had the surgery, it would alleviate the blockage. It would correct some of the symptoms that she was having, but the side effects, the additional suffering for her were just too great. It was too much to bear to say yes to. So the next question is to ask what will happen if the treatment is stopped and the condition follows its natural course. So the question in the case of my mom is, what if we don't do the surgery at all? And what we found out is, well, they could put in a simple stent without doing surgery that would allow the flow of bile through her biliary tube around the tumor that would be temporarily relieve her discomfort and her pain. Not going to be curative, not going to correct her cancer at all, but it would alleviate some of her discomfort. And if we did that, she would be more comfortable. She was going to die of this cancer within the next month or two, but she would be more comfortable if she had this smaller treatment, the stent put in. So in a sense, we were allowing her cancer to follow its natural course. We put in a stent that alleviated some of the discomfort for her so that she would have less pain as her cancer was following its course. So it's very important to ask the questions, get them to tell you what they think might happen and how they think things could play out. Even if there are two or three different possibilities, have them describe those possibilities to you so you can write them down to make sure you understand that. And the last question to ask is, what would you do if this were your loved one? I think this is a great question because we already know from studies that medical providers would do things very differently for themselves or for their family members than they recommend to patients sometimes. So I think it's a great question. Ask them to tell you the truth and please be honest with you. That can give you some insight into the treatment that's being recommended. Is this really something that makes sense to choose? Or would the wiser and kinder decision to be to say no to the treatment and to allow the condition to follow its natural course? The next step is to get expert advice. You can request a palliative care consultation. Hopefully, you're in a hospital that has a palliative care team. These days, there are more and more hospitals that offer palliative services. And the palliative team, which consists of a doctor, a nurse, a social worker, a chaplain, they can come in as a team and have a family discussion with you about all the questions that we just looked at in step number one. If you have enough time, if it's not a decision that has to be made right now in this moment, ask for a palliative team and for a family discussion. And you can sit around the table, you can review the questions, you can maybe you've already been told by the treating physician answers to those questions, but ask the palliative team if they agree and how they view these questions and really call on them for their advice because I guarantee you they've been through situations like this before and they've helped other families make these decisions. They've probably seen what happens with various alternatives. And it's really worthwhile to involve their expertise, especially when you're not sure what your loved one would want. And then try to recall any past conversations you've had. Maybe you have not specifically talked to your loved one about their end of life wishes, but think back. Maybe you've had a conversation about a movie you saw, or maybe they have a story about a neighbor who was in the hospital, and you can remember that and think, oh, that's right. They really didn't think it was a good idea for their neighbor to go back in the hospital and get more treatment. And I made a typo there. It's think back to any past discussion. Sorry about that. And then how did your loved one respond to the death of one of their loved ones in the past? Maybe you were there when, say, your parent uh, had their parent die? How did they respond? What did they feel about the death of their parent? And in my own case, I can tell you, my mom had told me stories in the past about her mother's death and her father's death. Both of them died alone in the hospital. And she was horrified by that idea, very upset that that's how her parents ended up dying. She didn't want that for herself. So that had been made clear to me long before through other conversations that we had had. So kind of rack your brain for any memories that you might have of things you've talked about before that could give you a clue about how your loved one might feel about the situation they're in right now. Number 4 is to consider the statistics from surveys that have been done over and over again for a number of years. We know that most people want to die at home without aggressive care. And that's the most common response on surveys, to the extent of 70 to 80% of people say they would prefer to die at home and not have aggressive care and end up dying in a hospital. So that is some guidance if you don't know for sure how your loved one might feel. Is your loved one more like an outlier who's likely to want something different than most other people want? Or would your loved one fit into this same category of people who would make that choice? Also, most people feel it is acceptable to stop treatment when illness is incurable. So, if you find out from the medical team that the treatment they're proposing for your loved one will not cure the illness your loved one has, will not make a difference, if it's not going to make them more comfortable or ease their pain, uh, it will only prolong the dying process. Most people do not want that. Most people feel it's better to stop treatment, especially if the treatment is not going to cure the illness. Number 5, I say this with quotes, ask your loved one. And of course, this is a situation when your loved one cannot speak for themselves, can't directly speak to you and say what they want, which is why you're being called upon to make the decision. But I recommend that you try this. Sit quietly with your loved one and ask for guidance about the decision that must be made. Maybe you say, Dad, um, I'm being asked to decide whether or not they should do this surgery on you, and I'm not sure what to do. I need you to tell me what it is you would like. And close your eyes, visualize that you're sitting across the table from your dad or whoever your loved one is, and visualize how they might answer your questions. Do you think it's a good idea to have the surgery? Would you want this? Do you want to keep being treated in the hospital? Would you rather go home? Um, would you rather stop the therapy that they're doing for you right now? So visualize them responding to you and giving you answers. You can listen for an answer if you're able to visualize your loved one, but you might also feel an intuitive sense that tells you how your loved one wants to proceed. I know for many people this feels out there a little bit, but honestly, if you spend a few quiet moments with your loved one, you may feel some clarity within yourself about the best way to proceed. And so I advise that you just take a little bit of time to be still and be in the presence of your loved one, listening to see if any answers come to you. And number 6, the last suggestion is to be gentle with yourself. Remember, if you have to make a troubling decision, if it sometimes might feel like there's no good answer, there's no good solution, it's normal to feel doubt and guilt after making a difficult decision. You may question yourself for quite some time. Did I do the right thing? Is this really what mom would have wanted? Was I being selfish? Did I really think of what's in her best interest? And it's normal to have all those questions arise, but please take care of yourself, be gentle. know that you've done the best you can. If you've asked these questions and had these conversations and gotten advice from experts, you've done the very best you can possibly do. You've taken your time, you've acted from love, you've made the best choice you could in this situation, and you need to allow yourself to find peace about it. You may have to forgive yourself and let go of any sort of blame that you're feeling. Remember, you may feel blame no matter what decision you may have made. You've only tried to do the best thing that you could do. And remember also that your loved one will forgive you and is forgiving you for any choices that you made, because you were in an impossible situation, trying to see a way through it and trying to do the best thing that you could do. So I hope that you can find peace if you are ever in a situation where you have to make a difficult decision for a loved one. And I hope this guide helps you through that very challenging process. Again, I hope you don't end up in this situation, because I hope that you will have had conversations with the people closest to you and that you've already heard them tell you what they want or how they would like things to unfold for them at the end of life. And make sure you tell them your wishes as well, so that they themselves don't end up in a challenging situation. So that's all for now. I'll see you the next time in the next tutorial. Bye bye.